Welcome to this month's edition of Picture of Health. I'm your host, Lauren Lingell. Today we are learning all about Alzheimer's disease, which is the 6th leading cause of death in the United States. In 2015, an estimated 5.3 million Americans of all ages are afflicted with Alzheimer's, and the direct costs of caring for those with Alzheimer's will total an estimated $226 billion. Today in our studio, we have with us Stephanie Thompson, the Director of Early Stage Programs of the Alzheimer's Association, Florida Gulf Coast Chapter, and Dr. Jeffrey Redout from Winter Haven Hospital to tell us more about Alzheimer's disease. Welcome to both of you.
Nice to be here, Lauren.
Thanks, Lauren.
Well, geez, now I have you all to myself and I can get some information with you to share with our viewers. One of the things that has always sort of confused me a little bit, I have a background in mental health, and I've never really been able to understand the relationship or the differences between mental health conditions and Alzheimer's and dementia. Can you maybe speak to that a little bit?
Dementia, we're really talking about a neurological condition. Now, certainly when there are changes in the brain, that can cause changes in emotional functioning, behavioral functioning, as well as the cognitive or thinking functions of the brain. Usually when we think of dementia, we think more along the lines of problems with memory or concentration or executive functions, but it really also, the brain is where all of our emotions and behaviors are as well, and so if there is some kind of change or deterioration, it can affect all those things.
Dementia is kind of the umbrella type of term. So when you think of dementia, there's about 152 different types of dementia. Alzheimer's, I know it's a lot. Alzheimer's disease is just one type of dementia. So if you want to think of, well, cars, for example, you know, what type of cars? There's many different cars. Same thing with dementia. Dementia is a collection of symptoms that affect the brain that interfere with daily functioning. And so the question would be, well, what type is it? Is it Alzheimer's? We don't know. That's why you need to get a good diagnostic. You need to have a diagnostic, or you need to go through a diagnostic process.
Okay.
But the other thing that we should say is that out of the progressive dementias, Alzheimer's is far and away the most common.
Like 60 to 80% of the dementias of the Alzheimer's type. There are different types: vascular dementia, which you're very familiar with, Lewy body dementia, Parkinson's disease could fall under a dementia.
Frontotemporal dementia, all kinds of different kinds of dementias.
Is there a theory of why Alzheimer's disease is the most common?
Well, there is some thought that what we call Alzheimer's may in fact be more than one syndrome.
Gotcha.
But because it presents in very similar ways, we kind of put it under that umbrella. The only way to really tell what's been going on in the brain is to do an autopsy. So, or a biopsy. We don't do biopsies on people's brains.
Can't imagine why.
Yes, we can't imagine
But we can be about 80 to 95% accurate of the type of dementia. So if you get a really good diagnostic workup, Dr. Redout does a lot of this with his neurocognitive lab. Is that what you call it?
It's the outpatient neuro rehab program at Winter Haven Hospital. And there and in my private practice, we do a lot of what's called neuropsychological testing, where we really put the brain through its paces and look at what kinds of things the brain is doing well and what kinds of things it doesn't do well. And there are certain patterns that emerge that can give us some ideas of what's going on, whether it's normal aging, whether it's something else, and what might be causing that something else.
Okay, so I'm going to back up just a second.
Sure.
So do I understand correctly that dementia is the umbrella and Alzheimer's is a specific type of dementia that falls underneath that?
Exactly.
Yes, perfect.
Okay, that is such a confusing thing for some people.
It is.
Myself
we get that
included.
question all the time.
We do.
Yeah.
So now that we've kind of set that up, how does one, I guess, get diagnosed with Alzheimer's? And obviously you're talking about these tests and things like that, but is it like, oh, I'm going to go to the doctor and I think I think I'm being forgetful, so
It's not like blood pressure where you can go and just get that done right away. There are some memory screenings that can be done, but Alzheimer's disease, let's say, look at that in particular, they need a doctor needs to rule stuff out. So it's not a B12 deficiency, it's not depression, it's not this, it's not that. There's other things they rule out. Usually a person will start with their primary care physician, and if the doctor is starting to rule stuff out and they still can't pinpoint what is causing whatever symptom is, so if it's short-term memory loss, the doctor is going to rule stuff out to see what's causing that. It's not delirium, blah, blah, blah. Then they usually get referred out, sometimes to a neuropsychologist like Dr. Radout. Sometimes they'll go to like the Bird Center, which is a memory disorder clinic. Sometimes they'll go to the memory clinic. Is it Baycare or Winter Haven Hospital? It's both.
It's both, yeah.
It's both. So there's lots of options. They could go to Watson Clinic to a neurologist, but usually you start with a primary care physician to rule stuff out, and then they do some deeper testing to find out, okay, well, what is this cause of memory loss or cognitive deficits, whether it be thinking or behavior.
Is there anything outside of the thinking and certain types of behavior? Is there, I guess, a list of symptoms that maybe loved ones might recognize and say, hey, what's going on?
The Alzheimer's Association, which is wonderful, 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 both locally and at the national level, has a very good website that has a list of symptoms that people might want to look at. The problem with sometimes early diagnosis is that there is a lot of overlap between the effects of normal aging and the effects of an early dementing illness like Alzheimer's. And so it's not unusual for someone to forget something. We talk about people as they get older, they start to think about the hereafter. They walk into a room and they wonder what they're hereafter. And so that kind of thing can happen in the normal course of non-pathological normal aging. When it happens a lot, when it happens real frequently, and when there are other things, forgetting directions, not recognizing a route that you take frequently, finding that people are telling you that you're repeating yourself, that you're repeating questions, you're repeating other things. Those things by themselves in small doses can be perfectly normal. As they start to pick up momentum, then they become more of a red flag. What's going on here? As Stephanie alluded to, I've seen people come in and they get their B12 level, they start getting B12 shots. That stuff goes away. Somebody who's depressed, they can look kind of demented. They get their depression treated, that goes away. I've seen people on a stack of medications. Sometimes if you can get rid of some of those medications, the problems go away. But if it's one of the ones that is more progressive, you want to find out about that early on because that's when the treatments are most effective.
So obviously, dementia and Alzheimer's specifically does affect an older individual. What is the age range you would say that you start to see these disorders?
People that are younger than the age of 65 can get Alzheimer's disease and do get Alzheimer's disease. It's less common, but it does happen. I mean, in our county, Dr. Red and I both have seen and talked to and work with people in their 50s that have Alzheimer's disease. So it can happen before the age of 65. If it happens before that age, it's considered a young onset type of diagnosis.
Gotcha.
And so when you think of that number, 5.3 million that you said earlier, about 200,000 cases are of the young onset type.
That is very sad.
And the other thing that if it happens earlier on, it tends to move faster.
Yes,
it tends to move slower the later it starts. And so that's another reason that early diagnosis can be very, very important.
So you may have said this already, but what is it that's causing this?
There's theories.
Yes, go ahead.
There's theories. So when we think of a theory, this is like, a really good guess by some researcher that has this evidence that says, okay, we think this is what it is. And then they look at those theories and they do testing on them to try to find, cures, medicine, other things with these theories. So the main theories are plaques and tangles, which are both proteins that are happening in the brain. All of us have them, but they go abnormal. Am I saying that right? They go abnormal for a person with Alzheimer's disease. And it's a little bit deeper than that, but in general, there's also inflammation that's happening. And we know what inflammation is. If you get a cut and it turns red, that's inflammation. So there's inflammation that's happening in the brain. Also, we know that there's cell death happening. And is that because of the inflammation? Is that because of the plaques and tangles? It could be a combination. A lot of researchers think it is a combination. And then the end of that is there's enough cell death in the brain that's impacting daily functioning. That's when the diagnostic process happens.
There's another theory that's out there now that they're exploring, and that is that Alzheimer's may be thought of as type 3 diabetes.
Insulin resistance, yes.
And so there's a lot of people that are looking at this at a lot of different levels. And sometimes they know that there are, like the plaques and tangles that are there in the brain, they know that they're there, but they don't necessarily know exactly how they are specifically related to Alzheimer's. They know that they're involved in cell death and that sort of thing, but it doesn't seem to be a one-to-one correspondence in terms of, well, if we can get rid of those, then the person's going to be okay, right? And that's where the deep research is going on and trying to find out what can actually help. Part of the reason that we're seeing more now is likely because people are living longer. And so there's more of a chance for people to develop problems. And that's what we see in terms of just the general population. At age 65, what is it, 5%?
1 in 8.
Yeah, all right.
Is that 5%?
That's a little more than 5%. But by the time you hit 90 or 95,
it jumps.
Yeah, it jumps to almost 50% of people have some form of dementia.
So what do we do? I mean, what are people doing to sort of treat this?
Well, I think we need to have hope for the future. And I have a lot of hope because I look at the progression of where we came from from 1906 to now, and I just see the advances that have been made. So we need to keep having hope and knowing that there's a lot of smart people out there working to find not only a cure, there's not a cure right now, they're looking to find a cure, but also to find medication that could actually make some kind of an impact. Also the diagnostic process.
To slow it down.
To slow it down,
yeah.
We've got to take a break now, but when we come back, we'll learn a little bit more about treatments out there and if they're doing any good.
We worry about loved ones when disaster strikes, especially when separated from our family members. So think about how you will contact each other should an emergency happen and you can't get home. As part of your emergency plan, have an out-of-town contact as a central point for communicating. And make sure everyone knows how to send text messages, because sometimes a text may get through during communication disruptions. Most importantly, make sure all family members know the plan. Learn the steps you should take. Visit ready.gov.
Thank you for joining us. I'm here with Stephanie Thompson from the Alzheimer's Association, Florida Gulf Coast chapter, and Dr. Jeffrey Redout from Winter Haven Hospital. All right, guys, let's get back into it. You were just talking about some of the things that we can do to really take care of ourselves and prevent Alzheimer's from
Taking hold.
Taking hold.
Yes.
Good word.
So some of the really basic things that you want to keep in mind, and that I tell to all my patients, is that anything that's good for your body is good for your brain. And so exercise and sleep are the two big things on there that I really encourage people. Exercise has been shown to actually be able to fight back against Alzheimer's and repair some of the damage that it does. Can't reverse it entirely, but it can be very, very powerful.
So will it slow it down?
Yes, it can slow it down.
Very interesting.
And so anything that helps you to be healthy, and exercise certainly is one of those. And we recommend that people get regular physical exercise. If you can't get up and walk around much, do chair aerobics, do something. But movement is very, very important to your brain. Sleep is very, very important to your brain, and we find that people who don't sleep well, especially as they get older, they do much worse on our cognitive tests, and they are more susceptible to dementing illnesses. So very, very important. It's also important that you stay away from the over-the-counter sleep aids. Not good for your brain. And so I talk with people all the time about what are called anticholinergic effects of many drugs that people take. And some of the most infamous of those are anything with PM in the title. Those drugs are anticholinergic. Acetylcholine is a chemical that the brain uses to help work on memory and that sort of thing. Alzheimer's, in some ways, sucks the choline out of your brain. Anticholinergic drugs suck the choline out of your brain. What are some of the drugs they give to help slow down Alzheimer's? They're called cholinesterase inhibitors. They're drugs that help keep the choline in the brain. And so you don't want to be working at cross purposes, but especially for the older brains, you want to try to stay away from anticholinergic drugs. And it's okay to ask your doctor or your pharmacist if any of the drugs that you are taking have anticholinergic effects.
Oh, good to know.
You have some other things that are important for...
We also talk about staying creative. That doesn't mean Picasso necessarily, but just doing something new, problem solving. Staying social also is really important, and then nutrition. And the most recent research for nutrition is the MIND diet. The MIND diet takes the Mediterranean diet and the DASH diet, and it kind of mixes the two together and gives a real simple approach. And I can't remember all the steps, but it gives you like 10 things to do and then about 4 or 5 things to stay away from. And unfortunately, red meat is one of those things.
Oh, man.
I know that it's suggesting that you stay away from. It does allow it a little bit, and some of the research on it says even people that adhere to the MIND diet about 65% of the time adhere to the MIND diet. There's actual benefits to it. So I don't know if everybody is like me, but I can never stay on a diet very long, so I'm not like 100% adhering to it. So if they can do just 65% of the time, it's showing to be a benefit.
That's a really interesting thing to know. I can't wait to tell my mom. She's always telling me, oh my goodness, something's going to happen to me. I'm like, Mom, you just got to take good care of yourself.
Yes.
That's right. That's the thing that you can do. Take good care of yourself, and if you think that there might be a problem, try to get evaluated early on. Because if you get evaluated and there isn't a problem, wonderful. But if you get evaluated and there is a problem, treatments are most effective in slowing down the progression of these illnesses the earlier they start. That's very, very important to start as early as you can. And so it's better, the testing for it, the evaluation isn't painful, it's not intrusive, nobody draws blood. Well, they do to take your B12 level, but it's something that people should do more of and not be afraid to get at least a baseline of how they're doing.
That's so true.
Where can people get this evaluation? They just go to their primary care physician?
Well,
and ask,
Medicare actually pays for a memory screening in your primary care office. So I don't think people regularly ask for that, but you can. You can ask, hey, can I have a memory screening? And the doctor should be able to provide that. So starting there, and then if the doctor sees that there's an issue, they can go further. Or if somebody goes to their primary care physician and they don't feel like they've gotten their answers to whatever issue it might be, short-term memory loss, cognitive problems, if they're not remembering names, then they can move on. They can go to a neurologist or a neuropsychologist, and they go to a specialist themselves.
So it's called a memory screening?
A memory screening.
And you would just ask one of your doctors that you'd like to have this test because you think that you're forgetful or you're experiencing some symptoms? That's great.
Yes.
Some of the memory screens are more effective than others.
Yes.
And some of them, especially for people with fairly high education and that sort of thing, may not detect anything until the person is much farther along in the illness. So they can be helpful, but if you feel like there's a problem, it's okay to go back to your doctor and say, yeah, I know that said I was okay, but I don't feel okay, and this is happening, and this is happening, and I'm still worried. Can I get further, more in-depth testing?
Yes.
So we really have to be an advocate for
Sometimes
our
you do,
healthcare.
yes.
Yeah.
Yes.
Well, switching gears a little bit, thank you for the valuable information that you shared about the disease. Now, something I've always wondered, Do the people who are afflicted with these diseases, do they know what's going on?
Sometimes.
That's exactly right. Yes.
Sometimes.
Sometimes not. There's nothing wrong with me. Why are you here in my office to be
Yes.
evaluated? Well, my wife thinks I'm crazy. Well, my wife convinced my doctor that your wife is very good at convincing people. Yeah, sometimes people think that there is absolutely nothing wrong with them, and they can be actually problematic. And when we start to talk about caregivers and that sort of thing, one of the things that happens as the disease progresses is that people who tend to be more compliant can stay home longer. It's the people who say, no, I don't care if the doctor said I can't drive, I'm going to drive.
Right.
Or I don't care if this or that or the other thing, I'm going to go and I'm going to take out all the money in our checking account and I'm going to go do this and that with it. So that makes a big difference in terms of the progression of it, and it varies a lot.
So those, I guess, full-blown cases where they've been dealing with the affliction for a number of years,
Yeah.
they're probably less likely to understand what's going on. Is that fair, or?
It depends.
It
It
just-
really does.
Okay.
Yeah.
I've seen what I've learned is that once you see one case, you haven't seen the other case, because it's an individual disease. Though there are some predicting patterns and symptoms that we usually see. Everybody's different. Everybody's going to kind of experience differently. They're going to have a different environment. Environment plays a major role on how the disease can actually look. I mean, if you have a couple and they are totally understanding with each other and there's great communication even throughout the disease process, the disease isn't going to look the same versus if there's a couple and there's arguments, or if the caregiver is trying to get the person with dementia to do something and is arguing with them, or the person with the disease is arguing and they're not being compliant, they're not wanting to take their medication. So it can look different depending on the environment, but also the individual. And so I think it's complicated.
It depends how much it affects behavior, and it depends how much it affects emotions. Some people, they get very belligerent, and they get very irritable, and it can cause a lot of difficulties.
But not in all cases. I've seen some.
Absolutely.
You see some cases, and it has really made the relationship stronger. If you want to believe that or not, I've seen it.
Right.
So, not all cases are going to be wandering cases, meaning not everybody with dementia is going to elope or leave or want to go back home and walk out and be an issue. Not everybody will have that experience. So we suggest, because it's such a family disease, meaning the person with the disease gets the disease, but everybody around them is affected because their loved one is slowly losing their cognitive processing, they're losing their memory, they're losing their ability to process information, which means they can't cook anymore, they won't be able to do the checkbook, they might not be able to drive. So this, family is going to have to step in, and that affects the family. So it's a family disease. Would you agree with that?
Absolutely.
It's
Oh,
definitely
yeah.
a family disease.
Oh, yeah.
And I think the Alzheimer's Association, one of the main things that we do is our services for family members, for caregivers. And that could be care partners. People in the early stages of the disease might have a care partner, and that care partner is just learning about it and learning how to adjust. Or when the disease progresses into the mid stages and they're doing more hands-on care, that's more of a caregiving role. So,
is it beneficial for them to go to counseling to sort of deal with the difference in the home setting?
It
or?
depends.
It
It
depends.
depends, yeah,
Yes.
on them, and how it's affecting, and what age it comes in at, and what else is going on, and what are the resources that they have. Some people, absolutely, counseling is helpful for them. Other people, they kind of shy away from that. That's not something that they've done in the past, and they feel a little funny about that. Some people really like to go to support groups. Other people don't want other people around. They might benefit from some individual counseling. Sometimes they might benefit from what's called occupational therapy, or from other kinds of therapy where it's more practically based. Okay, how do we set up the home so it's nice and safe? Do we want to put up big dry erase boards that have a calendar on them? Do we want to make sure there's lots of light, because there's this thing called sundowning where people sometimes, part of Alzheimer's especially affects how the visual system works. Not the vision per se, but the way that visual information is processed in the brain. And so when it gets darker, they really kind of lose their orientation, and it's harder for them to figure out where they are and what's going on. It really, as Stephanie was saying, it's a case-by-case basis where you kind of look at what kinds of things are needed.
I feel like, and not, because there's 15,000 cases in Polk County, okay, that's a lot. But we don't see all those cases. I want to believe that I see all those cases, but I don't. And when I see them, people call my office and we do 24-hour helpline. And if it's not me, it's somebody at our national office that's taking it. So we're talking to them and teaching them on the phone or listening to them or giving them resources. But we don't see all the cases. So I feel like that people are reaching out and getting information. And that's one of the big things that caregivers, I think, do that could benefit them, is to help normalize the disease would be to reach out and learn about it. Whether that be going to alz.org or talking to their doctor, going to a support group and learning that way, or going to some kind of a formal training, going to counseling, getting your doctor to write an order for occupational therapy, like Dr. Redout was suggesting, that practical application, which is excellent. There's different ways that I think caregivers can be better at being caregivers. It's not like we were born to be a caregiver. Some of us are just kind of thrown into it. And if they can do something to help them normalize the disease process, and what I mean by that is if they see their loved one maybe talk back or argue or not comply, if they learn that is because the brain is damaged, and their loved one is doing these things because of the disease and not because they don't love them anymore or they're mad or anything like that.
They're just ornery.
Yeah, they're just ornery. They're not taking it personal. It just helps. Yeah. It really does. Absolutely. It helps.
So you mentioned a website there. If somebody wants to learn more about Alzheimer's and maybe caregiving and that type of thing, support groups, what's a good website?
Yep.
And
alz.org is the main website, and then once you're in there, you can learn a lot. If you want to go to the local chapter, which I'm the local chapter, Florida Gulf Coast chapter, they can just type in their zip code and it'll pull it up.
Okay, perfect. Stephanie, Dr. Redout, thank you so much for being here. It was great to have you.
Thank you so much.
Thanks for having us.
Wonderful. That's all the time we have for today. If you'd like to learn more about Alzheimer's disease, visit www.alz.org. You can catch this episode of Picture of Health all month long on Mondays, Wednesdays, and Fridays at 10 a.m. and 4 p.m. on PGTV. Or catch this and our previous episodes on Polk Government YouTube. I'm your host, Lauren Lingell. Thank you for joining me on this month's Picture of Health.